Liver diseases are one of the most common problems all over the world, and in the study of a successful case, a patient's sister did an admirable job by stepping forward to save the life of her brother, inspiring many to join and serve this noble cause of organ donation. Dr. Biankolo Esumba, a Cameroonian and a gynecologist by profession, was diagnosed of liver failure and was referred to Manipal Hospital, India, for further treatment. A journey rich in emotions had made Dr. Biankolo to be another successful case of liver transplant thanks to his sister who opted to donate part of her liver to ensure her brother's survival.
In particular, cirrhosis and hepatocellular carcinoma, to tell them that hope is never completely lost. Reaffirming it and trying to demonstrate it is precisely the objective of this panel.
Liver failure is becoming a very common health threat among people of different age groups and can only be resolved through organ donation. And despite evolution in medical technology, there is still fear and stigma surrounding this selfless act. In Cameroon, liver transplant cannot be done simply due to the fact that Cameroon does not yet have the appropriate plateau to carry out such.
Colleagues like our brother Dr. Biakolo, who went to India because this was done. The technology is very advanced, and they're very advanced in these clinical sciences. Yes, we know liver transplantation is not practiced in Cameroon. You will not have it practiced. You have to go elsewhere. Yes, I think the reason why Cameroonians would always immigrate in order to go get care in India is really because of the advancement of sciences, clinical sciences most importantly, and technological sciences in India. We know very well. And of course, most importantly, second factor is the cost. These are very advanced and highly affordable care which are being offered in India.
Liver donation entails a series of steps both before and after. Here are a few things you need to know about liver transplant or organ donation.
There are basically, for a liver transplant, we need a human liver, at least at the minute. In the next, 50 years down the line, we'll be doing transplant differently. So a human liver is obtained through two sources. The first one is when there is a living donor who can donate a part of their liver. We don't take the full liver from the donor. We're able to take a part of the liver because the liver can actually grow. The liver is the only organ in the human body which can actually grow and regenerate itself. So if you remove part of the liver from the donor, like we have from Dr. Biakolo's sister, within a few days to 3 to 4 weeks, the liver will grow back fully. It is a wonderful organ. So that is living donor liver transplant. Now, the other source of livers is when people are, when people die in the ICU of modern hospitals where they're kept artificially, where their organs are kept artificially alive on a ventilator when they are brain dead. So generally this happens when the brain gets severely damaged because of trauma, injury, bleed, or some other type of problem. But the other organs are viable and are kept alive on a ventilator and life support systems. So the patient is brain dead, so this is the other source. Right. So, that is so here in Dr. Biakolo's case, we did a living donor liver transplant.
This practice is more advantageous when the donor is related and compatible with the patient. According to reports, the rate of organ donation is less than 1 donor per million people, which is relatively small, and as such, sensitizations are supposed to be carried out as organ donation does not only save the life of the patient, but also